The Omicron coronavirus variant is spreading rapidly around the world. Case numbers have exploded in many countries. In the United States, Omicron is now the dominant strain, accounting for 73% of all infections. Just a week ago, the figure was 12%. In New York City, virus cases are surging just ahead of holiday season gatherings.
5, 4, 3, 2, 1. Happy New Year! Woo!
This is just a test. New Year's Eve in Times Square has not come early, but the Omicron wave has hit the US sooner than many experts expected. Nearby, New Yorkers line up to get tested. With Christmas just days away and cases surging, many are worried.
It definitely feels like that first wave of the pandemic with that anxiety, all these long lines around the city, people getting tested, exams are getting canceled for people in grad school like myself. So it kind of feels like that early part of the pandemic where we didn't really know what was happening.
I think we've all been affected. As a New Yorker, we're trying to take every single precaution that we can. Got double vaxxed, boosted, regular testing. I am planning to travel for the holidays, but depending on the result of this test, I'll probably stay put in New York.
America's top pandemic advisor, Anthony Fauci, though, had a hopeful message for those worried about the holidays.
You can go the extra mile and get tested before you have a family gathering or a group. Get tested the day before or the day of getting together. But vaccinated and boosted people, when the family members are vaccinated, should feel very comfortable in getting together and enjoying a holiday meal or a holiday get-together.
President Joe Biden plans to address the rapid rise in coronavirus cases later on Tuesday, but he's already made it clear where some of the blame lies.
For those who choose to remain unvaccinated, he'll issue a stark warning and make clear unvaccinated individuals will continue to drive hospitalizations and deaths. That is not trying to scare people, or maybe it is trying to make clear to people in the country what the risks are here of not being vaccinated.
Despite the worsening situation, in Times Square, some people were still in a festive mood. But this might be the last time New Yorkers see these lights in person. The mayor still hasn't decided if New Year's celebrations here will go ahead.
Well, let's get more from Peter Hinchong. He's a professor of medicine at the University of California in San Francisco. Good to have you back with us. Tell us, Dr. Hinchong, a week ago, Omicron accounted for just 12% of U.S. infections. Now it's 73%. What does that tell you about the virus?
It tells us, Terry, that this virus is speeding ahead and forward like no other variant before. And if you think about 2 weeks ago, it was 1%. So it tells us really two things. First of all, that probably genomic sequencing lags what the cases really are in the community. And secondly, once you get enough people infected in a community, it's like little coronavirus bombs going off. The increase is really exponential.
Coronavirus bombs. What do you expect the situation to be like then 2 weeks from now in the U.S.?
Well, I see continued spread. I think it started off in the East Coast, really because of a lot of contact with the UK and with the Southern African countries. There are direct flights from Johannesburg, for example, to New York, New Jersey, D.C. It's not as prevalent maybe in California yet, although it's increasing. Our hospitalizations are not that high compared to the East Coast, but it's spreading westward. So I see a big sweep. I see a potentially unprepared hospital systems for this deluge.
Texas has reported what's believed to be the first known Omicron-related death in the U.S. Do we know yet whether Omicron is more deadly than other variants?
We don't know that for sure, Terry, but in many cases, this first death that's confirmed to Omicron in the U.S. is a metaphor of what's to come. This was an unvaccinated individual who was previously exposed naturally, but because of unvaccinated and unboosted, it kind of confirmed our greatest prediction and fears. Very seriously ill, death if not vaccinated. He got Regeneron, and these monoclonal antibodies are no good against Omicron, these particular types. We need others that are less available in the U.S. for them to work.
How well is the U.S. prepared for what's coming?
Well, I think we're not as prepared as we should be. I think this took the Biden administration by surprise. It came out of left field almost. And I think that, in all senses, testing has been seriously underprovided. Our hospital capacities are at breaking points regionally. National Guard is being called out. But I think probably the greatest potential casualty is not the physical beds. It's the, psychological state of American people at this point. We wanted to have a Christmas where we can go out to theater and see friends and family. And all of a sudden, this is at greatest threat.
Professor, thank you very much for talking with us. That was Dr. Peter Hinchong talking to us from San Francisco.
Thanks so much, Terry.
Now, the World Health Organization is calling on people to cancel some of their holiday plans to help contain the rapid spread of the Omicron variant. WHO Director General Tedros Ghebreyesus said there is now clear evidence that Omicron is more contagious than any other version of the virus so far. And he warned that holiday festivities would in many places lead to increased cases and more deaths.
All of us are sick of this pandemic. All of us want to spend time with friends and family. But an event cancelled is better than a life cancelled. It's better to cancel now and celebrate later than to celebrate now and grieve later.
Let's take a look at some other developments in the pandemic. New Zealand has postponed opening its borders amid concerns over the Omicron variant. Quarantine-free travel is now possible for New Zealanders only from the end of February onwards. In Australia, infection rates have surged, with the state of New South Wales reporting 3,000 new cases on Tuesday alone. But the Australian government has been reluctant to impose new restrictions. The European Union, meanwhile, has approved the use of the Novavax vaccine in people aged 18 and older. European Medicines Agency said data shows the vaccine has an efficacy of around 90%. Well, Germany's leaders are meeting today to plot this country's response to the Omicron variant. New cases have eased off recently, but experts are warning the next wave of infections could be the biggest yet. New coronavirus infections in Germany rose in the autumn, peaking at over 70,000 per day in late November, and have since dipped to around 50,000 in recent days. Well, here's a look at infection rates in other countries where Omicron is now dominant. The UK has hit its highest numbers ever, with 800 people per 100,000 infected over the last 7 days. The weekly rate in Denmark has risen even higher to more than 1,000. The Netherlands is below 600. Germany's infection rate is just over 300, but as we said, that is expected to rise quickly. A range of measures are on the table in Germany, including limiting social contacts, even for those who are doubly vaccinated or recovered from COVID-19.
Preparing for Omicron, Germany is rushing to get a vaccine booster shot to its critical workers, like these firefighters in Hamburg, before the new COVID-19 variant becomes dominant here. While daily cases are sinking across the country, experts warn the dreaded wave could arrive just after Christmas.
It's a
rapid exponential increase. If you take the conservative estimate that cases double every 3 days, or what scientists in Britain are reporting, every 2 days, you only need a pocket calculator to see that that's extremely fast. While vaccines are the first line of defense, Germany's government is preparing new restrictions for as early as next week, even for the fully vaccinated. We will have further restrictions on private contacts, so we're well prepared for the spread of the new virus mutation all over Europe. What the new curbs will look like is unclear. That still needs to be discussed with the leaders of Germany's states, but it seems everything is on the table. If experts' predictions are confirmed and what we're seeing in neighboring countries continues, then we can't rule out a general lockdown, including everything from businesses to education to private gatherings. For starters, that will likely mean canceled New Year's Eve parties, and those making fitness resolutions for 2022 might have to postpone hitting the gym until the Omicron wave is over.
Well, for more on Omicron, let's talk now to Hayo Zeeb. He's a research fellow at the Leibniz Institute for Prevention Research and Epidemiology. Thanks for being with us. Professor Zeeb, when are you expecting Omicron to become dominant in Germany?
Yeah, well, good morning. We are a little bit behind, I guess, but it won't take that long. I mean, it probably will be sometime early or latest mid-January that we'll have Omicron really as a dominant variant with us here.
Are the restrictions that Germany has in place now sufficient to deal with this new variant?
Well, let's say the current restrictions that we have right now are actually geared towards the Delta variant still. So, I mean, we are looking now towards the new restrictions coming up. The discussions today are going on, and the ministers will sit together and decide on more of that, probably roundabout or directly after Christmas. That's the expectation, that especially meeting people and contacts will be severely reduced. Probably the larger meetings, larger gatherings will probably be the rules will be changed again, and I'm wondering whether restaurants and all that will possibly close again. Yeah.
What are your biggest concerns about Omicron when it does become the dominant variant here in Germany?
Yeah, I mean, we heard it's spreading very fast. It will lead to a wave of new diseases, definitely, and it will end up in the hospitals. That's the one problem. So we already have a stressed infrastructure just about coping with Delta as it is, but there'll be more of that, and even probably bigger numbers in the hospitals. But then there's also now the discussion about that this it's just the Omicron infection will really affect critical services, be it firefighters and police and all that. So this is really something new. We haven't discussed this so far, and this is another threat that's up on the agenda really now.
What about the hospitals, the healthcare system in Germany? Is it prepared for this?
Yeah, it's really a problematic situation. We have a good hospital system. We have enough ICU infrastructure, but it's been stressed severely now through the Delta variant. We had to transport patients from one place to the other and so on. And this is only Delta. So now whether Omicron will even stress this more, and really especially the staff in the hospitals. That's the main issue. We have beds, but the staff is simply very much under pressure, and there are a few of them now, less than last year.
Dr. Hayo Zeeb at the Leibniz Institute for Prevention Research and Epidemiology, thank you very much for talking with us.
Cheers.